Hi, so I'm going to be doing the NG single lumen NG tube fitting video. So before doing this procedure, I would make sure to have my supplies. I would also make sure to check the order for the type of feeding and just the specific, if the patient was on a high calorie, high protein diet, I would make sure I have that specific feeding for the patient. So before doing this procedure, I would go ahead and knock on the door and announce myself. Hi, my name is Acacia. I'm going to be your student nurse for today. And I would want to provide privacy. Hello, sir. How are you doing today? Perform hand hygiene. I would want to go ahead and identify the patient. Sir, I'm just going to go ahead and identify. I'm looking for your arm bracelet. And I would want to look on each hand. Sir, could you please state your name and date of birth? All right, awesome. Do you have any pain today? 0 being the least amount of pain, 10 being the most. No? Okay, great. Do you have any allergies? Okay, no. Well, today we're going to be doing NG tube feeding. I know that you've been having trouble keeping food down, so this is to help you get your nutrients. Hopefully help you feel a little bit better. Okay, so I want to go ahead and adjust the height of the bed to at least waist level. So now that I've done that, I've explained the procedure to the patient. I'm going to go ahead and first assess the abdomen in order to know if there's any distension in the stomach before doing any feeding. So I went ahead and performed hand hygiene. I'm going to go ahead and I would tell the patient, okay, I'm just going to do a quick abdominal assessment. I'm just going to lift up your gown. So I would just note for any wounds/lesions, any distension. I would ask the patient when's the last time they had a bowel movement. First, I've assessed just by looking at it. Then I would go ahead and auscultate, and I want to auscultate at least a minute in each quadrant. So that would be at least 5 minutes for the full assessment. And I also want to count how many gurgles I hear. I want to hear at least 5 to 35 gurgles per minute, just to know that there is bowel sounds present. There was. Then I would go ahead and palpate. Lightly ask the patient, does it hurt as I touch? Can we say no? Great. Then I would make the documentation. So there's no distension, so we can go ahead and continue to feeding. I'm going to go ahead and raise the patient's head of bed. I want them at least at a 35 to 45 degree position unless contraindicated, and this is just to help mimic a sitting eating position to allow them to be able to digest everything well. I'm going to go ahead and put this down. I'm going to go ahead and first put this blue pad over the patient. So this is just to help protect your gown if there was any contents that came out. I'm going to first take my tape. I can find the ending to this. And I want to have at least 2 to 3 pieces. And one to measure where the end of the tubing is going to be. And then another to be able to hold it. I'm going to cut it in half here. Okay. So I don't have to, just an extra piece just in case. Okay. Here I have my distilled solution, and here's my feeding right here. It's not really feeding, but it's what we have. Here's my single lumen that I'm going to use. Now that I've went ahead and assessed the patient, then I'm going to go ahead and perform hand hedging one more time. Ideally, I would want to give the patient a cup and a straw, so that way that once they were to feel the gag reflex as the tube is passing, I would want to tell them to take this cup, but just pretend it's a cup. I would also want to ask them, sir, what nair is it easier for you to breathe out of, the left or the right? So I would ask them to include each nair and breathe out and tell me which one it's easier. And that would be the nair that I would want to insert the tube in. So we'll just say that they said that the left. So I would take my tube, first, actually, I'm gonna take my syringe, just keep it there to use. Here's my tube. First things first is I want to make sure to measure from the ear, tip of the nose to the xiphoid process, and I want to add at least 10 millimeters to that. So here's my measuring tape I'm going to use. So tip of the nose. And again, I would want to make sure to not touch this part of the tubing to any, my hand or anything. The xiphoid process, which is about right here. So I can go ahead and put some tape there. Okay. And then I'm going to take measuring tape. About 15 milliliters, and I want to add about 10 milliliters to that to give it some extra room. So I'd move the tape down to 25. Okay. So now that I measured the tape, I would then go ahead and make sure to document that. Then I would go ahead and start the process of inserting the tube. So, and I want to do it with my dominant hand, so I'm going to do it with my left, actually my right hand. And that way I can hold it with my dominant. Okay, so I'm going to go ahead and tell the patient, okay, I'm getting ready to insert this tube. I would go ahead and give them this little emesis basin, so if they felt the need to cough or spit up or anything, they could do that. All right, sir, I'm going to go ahead and insert the tube now. You might feel a little bit discomfort. Just take deep breaths. You're first going to go ahead and put your head back, and this is just to ease the process so you can go through the pharynx. All right, sir, I'm going to go ahead and insert it. Before doing that, though, I would go ahead and lubricate it with 2 to 4 inches of lidocaine jelly. Okay, so, all right. So now that I've lubricated it, then I would go ahead and insert it. Okay, go ahead and put your head back, all right? it's not actually going to go all the way in because of just how long the throat is to the mannequins, but I don't want to let it go. I want to make sure that I keep my hand on it until my tape is on there. And then I could use another piece of tape. So I can now take my hand off. The tubing is in there. First thing that I want to do is I want to, as I would have, as the patient had their head back then and they started to feel the gag reflex, I would have then told them to move their head forward and to use the cup and the straw that I gave them to sip and sip water until, just to help ease the process. But now that the tube is in there, I'm then going to go ahead and take my syringe and I'm going to aspirate to make sure that is in the stomach. So here is my pH strip here. I'm going to take my syringe, uncap, it's not capped, and I'm going to just go ahead and use this end of the tubing. And I just want just enough. And then I could go ahead and clamp this. I would go ahead and clamp it like that. Then I'm just going to check the pH. As I have the gastric contents here, I would go ahead and just check the color, the odor, the consistency. I want it to be clear to straw colored. If it's green at all, it could be that it has bile, which that is normal too. And then I'm just going to check the pH. Just put enough. And it's right below 5, so which is great because you want it to be acidic. And then I would take the remainder of my stomach contents, go ahead and insert it back through. Okay. Then I'm going to go ahead and flush. Sometimes when getting the gastric contents, you can get some that are still stuck in the tubing. And so you want to make sure that before starting the feeding, you flush to make sure that there's nothing that could cause the patient to aspirate. So here's my distilled water. And I'm going to go ahead and measure. So if the orders, I want to at least sometimes put 20 to 30, ideally 30 milliliters. So I'd go ahead and put my syringe to the side. And I would want to make sure that it hasn't been tampered with, it's not expired. Go ahead and open it, and I could pour out some. I'm going to go ahead and measure. So we have just about 30 cc's. Okay, so I don't want to damage any of the mannequins, so I'm not actually going to insert the solution, but I would measure it before inserting it, and this is just a clear, so I'll just kind of mimic that I would. And I would flush that slowly. I don't want to do it too fast that it would to irritate the intestinal mucosa. So I'm just going to put this back there. And I would watch the tube for it to run clear. Make sure that all of the gastric contents are out. And then I would clamp it once more. And this clamping it prevents any of the gastric contents coming back up to the patient through the nostril. So now that I've done that, I'm going to go ahead and insert the feeding. So here's my feeding right here. It's really saline, but you're going to see it's my feeding. I would also want to go ahead and measure if, depending on what the feeding said, so if they wanted me to give them 80 milliliters. I would go ahead and, again, make sure it hasn't been tampered with, isn't expired, is specific to this patient. I would go ahead and make sure to measure. Just about 80. Okay, so now that I've measured my feeding, I'm then going to go ahead and remove my plunger. And clamp my tubing. Insert the tubing. And then, like I said, I don't want to damage the mannequin, so I'm not going to actually put any distilled water in them. But with my tube here, I would go ahead and I've already measured my little graduated cylinder. I would go ahead and insert the feeding slowly until it all went through. And I would hold it at like a medium height, so that way it would enter the patient slowly, not at a fast rate, because that could cause them to aspirate and choke, and we don't want that. So I would continue putting in all this feeding until it was completed. And then, just to be sure, I would then go ahead and flush again with 30 milliliters of sterile water to make sure that all of the feeding has went through and there's nothing left in the tubing for the patient to be able to choke on. So I would then go ahead and take that, clamp my tubing once more. And I want to keep the patient in an upright position for an hour. And this is just to allow them to be able to digest the feeding completely without, again, aspirating. Aspiration is one of the biggest risks with doing this procedure, so we want to prevent any aspiration. And so now that I've done that, I would then dispose of my materials, throw on my gloves, and I would perform hand hygiene. And I would stay for just a bit, just to make sure that the patient was okay, that they don't choke or anything. I'll go ahead and put this bedside roll up. Put this bed down. And then I would want to come back and assess them, reassess their abdomen in an hour, and then put them back to a normal position. So we'll say that I've come back, I've assessed their abdomen, there's no distension, and I would go ahead and put their bedside down. And if the doctor wanted me to go ahead and leave the tube in, I would leave it in. If not, then I would go ahead and remove it. All right. Sir, is there anything else that you need before I leave? No? Great. Okay, thank you very much. All right, you have a nice day. All right, and then that would be the end of my procedure.